Good afternoon all. Today we are going to see next chapter of pharmacology and toxicology, that is the route of administration of the drug. Then what is meant by the route of administration? The route of administration means the way by which drug can be administered into a body is called as route of administration. म्हणजे ज्या पद्धतीने आपण ड्रग ऍडमिनिस्टर करतो बॉडीमध्ये त्याला आपण काय म्हणतो, रूट ऑफ ड्रग ऍडमिनिस्ट्रेशन. डिपेंडिंग अपॉन द रूट ऑफ ऍडमिनिस्ट्रेशन देर आर two types of effect. First is systemic and second is local. In systemic, the effect produced by the drug after effectively absorbed into the bloodstream is known as systemic effect. Means only a drug is absorbed into a blood stream and shows their effect is a systemic effect. And second is a local. Local means the area which the drug is applied on a part of body is called as local effect. Okay. Next point will be the classification of the route of administration of the drug. Firstly, see the diagram, and also there are mainly three types of route of administration of the drug: enteral, parenteral and local. Enteral means oral, through which drug is administered orally. It's called as oral administration in a enteral administration. Okay. Next is a sublingual. It is also a type of oral, but in sublingual route, we take a tablet or drug under the tongue is called as sublingual. Okay. Is a sublingual. Second and third is enema. Enema is a type of drug administration through a rectal route, by which drug is administered into a rectum for the easy or evacuation of the flatulences, means gases from the body, or to recover the constipation effect. Okay, it is a first type of route of administration. Then next is a parenteral. The parenteral type of route of drug administration is the drug administered through a injection into a body, and it is the second most common route of administration. And last is a local application. In this route, drug is applied to a local part of body. Okay. Next point will be the enteral. And in parenteral, there are two classifications. Firstly, we will see the classification of the route of drug administration. In enteral, there are three subtypes. In parenteral, there are two types: inhalation and injection. Then in injection, there are various subtypes like intradermal, subcutaneous, intramuscular, intravenous, intraarterial, intraperitoneal or intrathecal. And inhalation, it is also a type of parenteral administration. This point will be seen after enteral route of the drug administration. Next, the first type of the route of drug administration is the enteral. The word enteral is derived from the Greek word enteron. Enteron means intestine, and the drug enter into the gastrointestinal tract. Okay, there are three types of enteral route of drug administration. Then first is oral, sublingual and enema. We see one by one. Okay. Oral route. Oral route is a most common route of the drug administration. Okay. In this, the drug, the solid or liquid taken through a oral route or kept into a oral cavity and swallowed with the drink like water or milk. Most commonly, we take the drink as a water. Okay. Then first pass effect. What is meant by the first pass effect? It is used in the hepatic metabolism of the drug, where the greater the first pass effect, lesser the amount of drug reaches into a systemic circulation. Systemic circulation means which reaches the blood circulation. In this, firstly, first pass effect means hepatic metabolism means in the liver. The process which occur in the liver is called as hepatic metabolism. Okay. Then we will see the advantages of the oral dosage form. It is the most natural and easiest way of the route of administration of the drug. It can be taken by a self. Means we can take drug by a self after the consultation with the doctor. Second, it is economic. Economic means we can easily bring and easily available, and also it is a low cost as compared to other drugs. Then it is safe to all patients. In parenteral, it is not safe because a trained person is required to give a dose of parenteral drug. In this oral administration, no other person is required for the giving a dose of the drug to the patient. Next advantage is the drug is administered by this route, doesn't require any complication process like a sterilization. Sterilization is only needed in the case of parenteral, because in parenteral administration the drug is inserted into the body. Therefore, maybe a microbial contamination occur. That's why sterilization is important. Okay. Next, then disadvantages of the oral dosage form. What are the disadvantages? The first, most common, it is the onset of action is slow. Means after the administration of the drug, it reaches and it shows effect after 1 or half an hour as compared to parenteral drug. Parenteral drug shows a high onset of action because they are directly inserted into the body. Okay. Then next, not suitable in emergency or for unconscious patient. Unconscious means the patient which are not able to talk or which are unconscious in a state. This drug, this dosage form is not suitable for the unconscious patient. Next, not convenient for the patient with a gastrointestinal disorders such as diarrhea, constipation, ulcer, hyperacidity in the stomach. These drugs may show a delayed action, and following disease may shows a side effect on a patient. That's why it is not convenient for the gastrointestinal disorder. Okay. Next, high dose of the drug is required as compared to the parenteral. Parenteral, we give in parenteral drug that is 0.1 ml, 0.2 ml to achieve a concentration of the drug in a patient for the treatment of disease. In oral dosage form, we give 500 mg or more than 100 mg drug. Therefore, in oral dosage form, high concentration of the drug is required. Some drug from the inactive complex, they form a complex with the food present in a GI tract. GIT means in the stomach also. For example, tetracyclines, mainly the antibiotics, forms a complex with a present food. That's why doctor prescribed on how to take a tetracycline. Mainly, the tetracycline is not given with the milk. It may produce a various side effect. Okay. Next point will be, it may produce a irritation or unpalatable substance. By this way, unpalatable means which are very obnoxious or आपण जे सबस्टन्स आहेत जे आपल्याला ज्याचा स्मेल खूप खराब येतो तसे सबस्टन्स आपण या रूट थ्रू मीन्स ओरल डोसेज फॉर्म थ्रू आपण नाही घेणार. नेक्स्ट, less amount of drug reaches to a target tissue due to the first pass effect. This point is covered by me at the first slide of the oral dosage form. What is meant by the first pass? Already tell that lesser amount of drug shows a lesser action on a target site. Therefore, we are going to we are preparing for a higher dosage. Okay, these are the side effects of the oral dosage form.